talk about the mysteries of sinuses. Let's start with this. Why do we have them? What do they do?
So they help to actually lighten the head. So they're air-filled cavities, 4 of them, 2 sets of pairs. And they lighten the head. They help to circulate the air, humidify it, filter it, warm it as we breathe it through our nose. And they also help to serve as a protective mechanism for a head-on collision.
Wow, so why do people have so much trouble? So tens of millions of people have sinus problems. Why?
Yeah, so 12 to 15% of the population develops a sinus infection every year. And really the underlying pathophysiology or problem is that inflammation starts in the lining of the sinuses and the lining of the nasal cavity, and it blocks the normal mucus that drains from these sinuses, and that's when you get trouble. That's when you get your infections. They can be acute.
Well, you can point to where
Sure.
it's not one spot where the sinuses are.
Correct. So right down the middle. And here we see 2 of the 4 pairs of sinuses. So this is the frontal sinus here, kind of right in front of your forehead, or right in your forehead. And then this is the sphenoid sinus, which is actually kind of in the middle of your head, as you can see here. You also have your maxillary sinuses, which are the cheek sinuses right underneath your cheeks, and the ethmoid sinuses, which I describe as a honeycomb-shaped sinus between your eyes. So you can't really see it on this picture, but
You can see how if you had a problem in there, there's no easy way out, put it that way.
Right. So yeah, there are very small drainage pathways for each of these sinuses, and if they get swollen, if the lining becomes inflamed and swollen, things can get kind of stuck in there.
What kind of pain do people get when they have a specific problem in one of those spots?
Yeah, so people will generally describe a specific pain in that location. For example, for the maxillary or the cheek sinuses, they will describe cheek pain or even tooth pain. They'll think it's a tooth infection. For the ethmoid sinuses, they'll describe pain between the eyes or behind the eyes. Frontal, you have a pain right in the front of your head. And then the sphenoid sinus, interestingly, you can present with pain right at the top of your head called a vertex headache, or right in the back of your head called an occipital headache.
Can they tell from a diagnostic standpoint? Are there enough clues to make a decent diagnosis?
Yeah, so most of the time we have to discern from a constellation of symptoms. So it's not only facial pain and pressure, but it's also decreased ability to breathe through your nose, discolored drainage from your nose, and then change in your sense of smell. So really we use those 4 constellation of symptoms to determine whether or not someone has a sinus infection. And based on that, that's where and then the duration of symptoms as well will determine how we treat the patient. We don't usually recommend for any other imaging or anything like that at that point in time when they present with an acute symptom.
Can reoccurring sinus infections cause damage to other nearby areas, the eardrums, the throat, the brain?
So that's a great question. So acute sinus infections can cause complications. They can spread to the brain, they can spread to the eye, so they can be pretty detrimental. It's not necessarily the recurrence of them, but it's just if you have one very bad, severe one. So yes, acute sinus infections can be very detrimental, and typically we recommend if you've had an infection for over 10 days, or if you've had it at 5 days, if you have worsening in your symptoms, you really should get checked out by a physician.
Self-care.
Yes.
Maybe a saline spray. Is that
Yeah,
right?
exactly. So from, when you first start noticing that you're coming down with something, you want to start with the symptomatic management. So decongestants, both topical and oral. The saline rinses. So I usually really tell my patients that, it can't hurt to use a saline rinse, particularly if you're using one with distilled or boiled water. That helps to kind of flush the mucus out, flush anything out, and help to clean things out. And then symptomatic treatment in terms of pain management also help at that point. You really, at the time when if you notice improvement and then worsening after about 5 days or so, or if it's been about 10 days, that's when you really want to seek medical care.
And what's the first thing medical care is going to do?
So they're going to most likely put you on an antibiotic based on, at that point in time, based on your symptoms and based on what the most common bacteria are that cause sinus infections.
Does that typically resolve it? And how, over what period of time?
Yeah, so that typically does resolve it. It can take, a few weeks or so to feel kind of back to your baseline, but it's going to be about a 10 to 14-day course of medicine, depending on what the antibiotic is. Typically, if you go to an internist, they're not going to necessarily culture your nose because the sensitivity of that culture is pretty poor. But if you go to an ear, nose, and throat doctor, a lot of times we will take a look in the nose with a camera, and we will, if we see pus, we will culture it to get you culture-directed antibiotics.
Is it seasonal? Do you see more problems with, colds in the winter, hay fever in the springtime? What do you see?
I think maybe I'm a little bit biased just because I'm an ear, nose, and throat doctor, and a lot of people come to me specifically for that. So I see patients with sinus infections all year round. But yes, definitely in the wintertime, when people have an increased incidence of upper respiratory tract infections. In the fall and the spring, with seasonal allergies, that definitely increases the prevalence of patients with sinus infection.